So to start, we have Raman Mastani and Whitney Engerin Cordova. We're going to talk a little bit about can Gen AI help end HIV? Go for it.
Good morning. Hi, everyone. Thank you for having us, first of all, Nate especially, for putting this together with other folks. So my name is Raman Mastani. I'm the CEO at Healthvana. As a company, what we essentially do is help patients figure out if they're okay or not. And that's the most urgent thing we've done as a technology company. And we're essentially a patient portal that doesn't suck. It actually works pretty well. So we've delivered 50 million health records to patients across 25 states. We're really good at engaging patients with their health and helping them think about what they're supposed to do next. We've had our work featured everywhere from different universities to the White House. I'm excited to be here with Whitney today, who's been a collaborator of ours as a technology company on the healthcare provider side. And you go next.
Great. Hey, I'm Whitney Engerin Cordova. I'm the Vice President of Public Health Programs for AIDS Healthcare Foundation. AHF is the largest provider of HIV care in the world. We are currently serving about 1.9 million folks in 45 countries around the world. Here in the United States, where I primarily focus, we have 39 sexual health clinics. We call them wellness centers, where we provide STD and HIV testing and treatment. We have 22 mobile units and about 18 other sites in 17 states around the United States. So there are about 1 million folks living with HIV in the United States. Of that percentage, 40% are Black and 28% are white and 25% are Hispanic. There is a huge disparity between what's going on with the epidemic and the people who are getting access to preventing themselves from acquiring it. So what do we do when the population of the United States is 59% white and 12.6% Black, and we have these disparities in this disease? What do we do? And part of that is access. Part of that is access to healthcare and good conversations with their healthcare providers.
Here's the demo, if you can hit play. And then we'll go over some details about it afterwards. This all starts, by the way, when a patient gets a message about something on their healthcare, and it prompts them to go in.
Back on the first slide, we wanted people to have 3 different ways to interact with the AI. One is kind of Joe Blow, normal guy, just giving you scientific information. The second one is a drag queen. And the third one is talking to a human. And although it's funny, and you're reading as you go, so laugh as you care to, there's a reason for it. And the reason for it is that people feel uncomfortable sometimes talking to their healthcare providers or discussing their sexual health. We have a problem at AHF, and that is that we quite frankly just don't have enough clinic space and don't have enough people. I need to be able to use people when the encounter is going to be the most effective. Not to answer the phone and say, yes, our hours are from 6 to 5, or yes, I'll make an appointment for you. That's using a ton of staff time when we have tens of thousands of people calling us on our hotlines. When we first associated with Healthvana, they started working with us on just texting and information. We reduced our calls to our clinics by 90% just from their app.
For us, it's very much about helping build a relationship with the patient. And we think this is one of the best ways to help foster a better relationship that can lead to better health outcomes for the patient to stay on their medication, get the questions they want answered. And this is one of the biggest keys, without stigma. In a lot of parts of the country, there's going to be a lot of stigma around. There's a stigma within certain groups, families, cultures. And so this is really something we think that will be helpful. So I can also tell if there's more technical questions. This is on OpenAI. We have a business associate agreement with them, which is HIPAA compliant. We can't use protected health information as training inside of that model, but we have really complex prompts that is from our experience of the last number of years working on this. And this is the very first iteration that we'll be launching, and if it goes well with a small subset, it can be out into 17 states in the next few months. No, that's coming soon. The next phase is going to be to start testing it. We came up with a couple of personas we thought would be interesting and garner some attention. The drag queen certainly will. We'll want to see
It's
how...
also fun.
Yes, it is. The language is great. It delivers good information. We've been playing with it for a couple months. But dealing with the most sensitive information by way of HIPAA and healthcare in the country, we're very thoughtful about how we go about this. But we also want to make sure patients want this. Maybe they just want the answer. Maybe they want it from, whatever you called it, the standard. And the third option, by the way, was if you message your provider as you normally would. So instantly you're being told that this is 24/7, it is AI, but if you want to message normally, here's how you do it. So we're really interested to see how that starts to play out. Our sense, given that we've been doing this for a few years and have had hundreds of thousands of these messages come, is people will be really excited to be able to get real-time information.
It's important. Why don't you tell them what the open rate is on when people get a message from Alvana, what that?
Yeah, it's in the high 90s. So when we send a message, we built trust over a number of years with patients. I think that's the core thing of what we were able to do. So a lot of these folks, it's not that this is a direct consumer product. This is already in the framework of working within your healthcare provider and getting this information out.
Well, I think we're discussing guardrails, right, for what are the, if you ask, something that really needs to be, they need to speak to a doctor, or they're gonna need to speak to a medical provider, we're gonna be able to say to them, hey, you know what, that's a great question. Let me see if I can get you to a medical provider. Now, if it's during business hours, we might be able to just hook them right up to a virtual appointment right that sec. Because that's what we really like to do, right, is we don't wanna lose the moment. If somebody's asking it and they're talking about it, any delay between getting them to the answer or them to treatment is potentially losing that person. So we're trying to get to that. So we are putting those guardrails in and discussing what that's gonna look like. And we'll test it.
Instant care. I mean, that's a lot of it.
It's gotta be, or we're not gonna get it done, right? I wish we were back in the days when, we fought battles as we were starting off on doctors wanting to review, our doctors inside AHF wanting to review labs before they went out to the patients. It's like, we fought that battle for 2 years, and it was like, sorry, it's going.
Right.
It's their information, it's their bodies, it's their blood. They're gonna get it. And we'll help them understand it. If they need to talk to you, great, but you don't get to see it first because that delays everything. It's become so widely understood, kind of drag culture in the overall society, thanks to our friend RuPaul, that I think it represents very much for people accepting people for who they are and accepting people however they come to you. And so I feel like that kind of feeling was something that we wanted to convey, not just because I love my drag queens, but because it's about acceptance. So I really felt like that was more of a way to say, however you're coming to us, we want to talk to you.
Where this will end up going, I think, is you'll have your phone and you'll have conversations, and it will be the persona you've chosen, and you'll have conversations back and forth. And that's where it's going to be more, as opposed to even typing and looking at something. This is going to quickly go into using voice.
Yeah.
And then you're talking about a different dynamic and making sure that people know that it's artificial intelligence and how it's coming across and how you want that information to be there. But think about the access that helps with, especially with underserved populations. This is the kind of stuff we get really excited about.